Good morning, everybody. Thank you, Mr. Chairman. Thank you, Professor Assam and Professor Nasser and Professor Said Ali for the kind invitation. Chronic limb shortening ischemia is an advanced stage of the peripheral arterial disease with varying degrees of wrist pain that is not responding to regular painkillers for most of the time, more than 2 weeks. And also it's associated with ischemic ulceration and tissue loss like gangrene. Classification, as we know, Rutherford classification, mainly grade 4, 5, 6, and Fontaine stage 3 and 4. And the task classification mentioned ankle brachial index less than 0.4 and toe pressure less than 50 millimeter mercury. The incidence of chronic limb-threatening ischemia is increasing in the developed countries, and also it's increasing rapidly in the developing countries, most likely because of the aging of the population, diabetes, and smoking, with a poor prognosis in terms of limb loss and premature mortality. As we're looking here in the scheme, the critical limb ischemia around 1 to 3%, and the 1 year outcome for the amputation is around 30%, and for mortality is 25%. And for the patients that at the beginning diagnosed as a peripheral arterial disease with intermittent claudication, the 5-year outcome from them that 5 to 10% of them will change to critical limb ischemia, and they will need an amputation of the lower limb. And for amputation, this will increase the economic impact, mainly as this patient will need more home health aids. Some of them will need construction and home adaptation, and this will end with longer hospital stay and more increase in the cost, and also the influence in the work, the economy, and the long-term health care cost. This is a single center prospective observational study that compared between the procedure cost, the total in-hospital cost, and the follow-up after 12 months cost for patients that got either vein bypass surgery, best endovascular treatment, or major lower limb amputation. And this was done in Birmingham Hospital on the critical limb ischemic patient in the basal prospective cohort study. And this showed that there's in the procedural cost, the bypass surgery was the highest cost, and for the in-hospital cost, it was more for the major lower limb amputation. And in the sum of in-hospital cost and the follow-up for 12 months post-operative, it was also high for the major lower limb amputation. With a limb salvage program in the United States, they found that an established limb salvage program can save the cost on around 26 billion per year. Over that, there is also the quality of life and the depression and anxiety for a patient with critical limb ischemia. In this study, they have the score for anxiety and depression for critical limb ischemia, and they have the score baseline preoperatively, early postoperative, and late postoperative. And they found that patients with critical limb ischemia, they have a high incidence of anxiety and depression symptoms. This is a sub-analysis for the best CLI trial regarding the quality of life, and most of the patients, they got the health-related quality of life measurement tools, and they found that patients with critical limb ischemia in this study, they have a very low health-related quality of life score, and most of them has a history of smoking with impaired ambulation and opioid use, and more in female sex. Staging here for Wi-Fi classification is mainly to use the factors that affect the amputation risk and the clinical management, and this can be augmented also with the GLASS classification that was published in the ESVS, and it mainly classifies a pattern of arterial disease, and they are defining the target arterial path. And the grading here is mainly for aortoiliac inflow disease, femoropopliteal disease, infrapopliteal, and inframalleolar orbital disease. In 2005, the first analysis for the BASIL trial shows that there is similar short-term clinical outcome for the bypass surgery compared with the endovascular first strategy. But in this study, they do a further 2.5 years follow-up for intention to treat analysis regarding amputation-free survival and overall survival, and they found that in average risk patient with critical limb ischemia with a life expectancy more than 2 years, that the bypass first strategy was associated with a better outcome regarding the amputation-free survival and overall survival. This is another comparative study, and it was done in UK, and it's mainly for patients who have plain balloon angioplasty that was running in the hospital between 2009 and 2014, and the result was compared against the observational outcome of the BASIL trial, BASIL 1 trial, and they found that patients treated during the time between 2009 and 2014 had a significant worse of the amputation-free survival and overall survival. And for that, this study did not support the hypothesis of widespread adoption of the endovascular first strategy, and they recommend the vein bypass should still be considered as a gold standard treatment for critical limb ischemia patient. And finally, the result of the PEST CLI international randomized control trial that have a 2 cohort of patients. The first cohort, a patient with a single segment great saphenous veins that are suitable for a bypass surgery, and cohort 2 patients who need an alternative conduit like upper limb conduits. And they found, and the primary outcome was the composite of major adverse limb event, either amputation, reintervention, or death. And the result was found that patient with critical limb ischemia was an adequate single segment of great saphenous vein, and these patients are suitable for both intervention, the bypass surgery or the endovascular surgery. They found that the initial bypass surgery strategy have a lower incidence regarding major adverse limb or life compared with the intervention, with the endovascular intervention. But patient without a suitable great saphenous vein, the result was almost showed no significant difference. This is one of our patients in our hospital, 55 years with critical limb ischemia and tissue loss on the left hallux with low TBI and toe pressure. He got a good segment of a great saphenous vein, and we did for him a left popliteal to posterior tibial bypass. And after the surgery, his toe pressure was markedly improved, and he has complete healing of the ulcer after 6 weeks. So in conclusion, critical limb ischemia patient should have a proper assessment of their overall comorbidities.
Another minute.
Should have the assessment of their other medical comorbidities in conjunction with the full assessment of their lower limb vascular disease, and also the health-related quality of life problem should be considered in the discussion with the patient regarding the possible intervention. And again, the bypass surgery, either infrainguinal, infragenicular, or pedal bypasses for patients with critical limb ischemia with a single segment great saphenous vein is still the first option for treating patients with critical limb ischemia. Thank you.